So I would just ask you all please to mute your microphones for the time being so that we don't have any background noise disturbing us. And I would like to say thank you so much to Sofia Aziz, who is turning into something of a regular on the Explorers Club, which is excellent because she's fantastic. So without any further ado, I shall hand over to you, Sofia.
Hi, everybody. I'm going to share my screen, if that's okay.
Oh, yeah, hang on. I need to do something so you can do that.
Okay. And fingers crossed that my internet doesn't go this time.
I've actually got internet back after a year of not having internet, would you believe?
Wow. Right, shall I try and share?
Yeah.
Is that okay now? Let's have a look. Oops. Okay. Sorry,
Yes,
just
that's
bear
working.
with me 1 second. Okay, I've got a slight technical issue. I'm just trying to. Okay, here we go.
Not the same as enough technical issues.
Right, I think we're good now. So, hi everybody. Hi everybody, it's a pleasure to be here today. Lovely to see you all. And thank you, Sarah. I can't believe you've had me here for the 3rd time. That's wonderful. So today we're going to be looking at disease, disability and healthcare in ancient Egypt. So I just want to start by saying that I think it's really important to look at diseases of the past because they help us understand diseases of the present. Ancient DNA studies in particular are radically changing our understanding of the genetic architecture of disease and providing a fascinating insight into their evolution. So we're all impacted by the current pandemic, of course, and it's taken its toll on us emotionally, physically. It's been a really tough time for everybody. And it's almost like it's difficult to remember life before COVID. And I found myself wanting to know more about other epidemics and pandemics throughout history. And the 1918 flu pandemic, for example, is estimated to have killed around 50 million, perhaps even 100 million people. It was one of the worst pandemics in history. Nobody knows where it began, but it was caused by the H1N1 virus with avian origin. And it was a second wave of this virus that struck with incredible intensity. So the variant strain was lethal, and the symptoms were so severe that sometimes doctors would think the patient was suffering from malaria or dengue fever. It was horrific. And what I found interesting was the similarities with the medical treatment. So it involved isolating the sick, just like what we've been doing with COVID. People were urged to wear masks. Eventually, public gathering was banned. Schools were closed. So too were places of worship, theaters, shops. And some of the cities in the US, they report that people had to be buried in mass graves. So some of the scenes were sort of reminiscent of the Black Death in the 1300s. Of course, that pandemic eventually ended, and we have to believe so too will COVID. Today, however, and I'm going on a bit, but we're going to go back even further in history, and we're going to take a closer look at some of the diseases that the ancient Egyptians had to contend with. And as we're living through the devastation a virus can cause, I'm going to begin by looking at viral and bacterial infections, and then we're going to look at arterial diseases, cancer, and some other diseases. So, we've been interacting with microbes from the beginning of our existence as a species. We even share a common ancestor with them that appeared around 3.5 billion years ago as a single-celled microbe. We wouldn't actually have been able to exist without microbes. In fact, we're home to trillions of microbes that do us an enormous amount of good, but of course there are some that make us sick. Now, what exactly is a virus? And I'm guessing everybody's Googled this because of what's going on at the moment. But here on the slide to the right, we can see the different sort of forms that viruses take. So basically, they're just a bit of protein with genetic material, which is either RNA or DNA. And technically, viruses are not even alive, but the key to their success is in their simplicity and how they can hijack our cells and replicate. In fact, 8% of our DNA is thought to be made up of remnants of ancient viruses. They are incredibly, incredibly tiny. Bacteria, on the other hand, they are living organisms, and we can see on the left of the slide some of the various forms that viruses take. They're single-celled, and they thrive in diverse environments. They don't contain a nucleus like our cells, but they have DNA, which you can see sort of just floats inside them, or in a circular piece within them, which is called a plasmid. Ancient DNA studies are finding that gut and oral microbiomes of particular interest. So let's have a look at some of the microbes that made the ancient Egyptians sick. So we're going to start off with smallpox. This is caused by the variola virus. It's spread by face-to-face contact through droplets from sneezing or coughing, like COVID. Symptoms include fever, discomfort, headaches, severe fatigue, severe back pain, and sometimes vomiting. So red spots would appear on the face, hands and forearms, and later on the trunk of the body. So these lesions then turn into small blisters filled with clear fluid, which then turns into pus. So scabs begin to form, which eventually fall off, leaving deep pitted scars. So the earliest case of smallpox was found on Ramesses V, whose mummy we can see on this slide. He was discovered by Lorette in the KV35 cache. And as you can see on his face, he has some very distinct lesions all over here. So Grafton Elliott Smith, who we can see on this slide, he studied his mummy and deduced that these were pox virus-like lesions. So he found these lesions on Ramesses V's face, his neck, his chest, his lower abdomen, and he thought it was likely that Ramesses V had actually died of smallpox. So Smith, by the way, he was professor of anatomy at the University of Manchester for 10 years until he left in 1919, and the university still houses his collection of skeletal material. So going back to Ramesses V, in 1976, a small sample of his skin was tested for variola virus using electron microscopy and radioimmunoassay, but the results were inconclusive. And then a more sensitive test called immunoprecipitation eventually confirmed Smith's original diagnosis of smallpox. So immunological studies, they basically identify antibodies indicative of infection. So they're checking antibodies, antigens. So the diagnosis of Ramesses V, however, is not accepted by everybody. Not everybody's agreeing with the science. And this is because widespread evidence of smallpox in Egypt is lacking. The only other diagnosis of smallpox is by Ruffa and Ferguson in 1911, who identified smallpox in a mummy from the 20th dynasty. So the problem is, I think, smallpox, it doesn't really leave traces on the skeleton. So it has to be detected on tissues. So if we're only looking at skeletal remains, it's probably harder to detect. So maybe this is a problem, it's been missed. But if we have a look at this slide, we can see how devastating smallpox is. So this is a young girl from Bangladesh who sadly was infected with smallpox in 1973. But thankfully, smallpox was wiped out globally in 1980, and you can see why there was this global effort to eradicate this disease, because it's truly traumatizing and very awful. So now we're going to have a look at bubonic plague, and I wanted to talk about bubonic plague because I know, Sarah, you've been asking me about plague for some time, and the plague is interesting. is an infectious disease caused by the organism Yersinia pestis, which we can see in the black and white picture here. So it's a zoonotic bacterium, which is normally carried by rats. We can see those little fellows here to the right. So it's transferred to humans by the flea Xenopsila, which we can see here. So this flea usually affects the rats, and then it jumps to us, and this is how we catch it. So symptoms include fever, chills, headaches, painful swellings of the lymph nodes in the neck, armpits, and groin, and these are called buboes. So there are, by the way, two other types of plague, which are septicemic, which affect the blood, and pneumonic, which affect the lungs. So it's been suggested, so you can actually start with bubonic, and then it can form into the other two as well. So it's been suggested by some scholars that concert tumors, which are mentioned in Papyrus Ebers 874 and 877, are referring to the buboes of bubonic plague. But to date, no evidence has been discovered on mummified remains. And there are alternative suggestions of what concert tumors can be, which I'll be talking about in a bit. So in this slide, we can see an image of blackening of the skin due to septicemic plague. So you can see how devastating this disease is. Your skin's actually decomposing while you're still alive. It's truly horrific. And here we can see the buboes, the bubonic plague. So it's been suggested by Kozlov in 2006 and others that plague could have afflicted Egypt during the reign of Amenhotep III. This would account for the unprecedented attention that he gave to Sekhmet, who was the goddess of pestilence and plagues. So if you go to the Temple of Mut in Connacht, you'll see a huge amount of Sekhmet statues, which some of these are in this picture. So this is, however, circumstantial evidence and is yet to be proven. So Eva I'm going to try and pronounce her name correctly, Eva Panayotokopoulou, I hope I pronounced her name correctly, in 2004, she suggested that the Nile rat was the primary host for the flea Xenopsila, and she pinpoints Egypt as the most probable place of the origin of bubonic plague as an epidemic disease. So she thinks that Xenopsila may have carried a previously rare disease that jumped from the Nile rat to the black rat, which was introduced through trade with the Mediterranean, Africa, and Asia, thereby providing it the opportunity for an epidemic. So she considers evidence from the medical papyri such as Ebers, Hurst, and London to support her claims. But I think, really it's going to be future DNA studies that will shed light on this. There has been a recent study in which the presence of Yersinia pestis has been discovered in 300-year-old specimens from archaeological sites in France using the technique of paleoproteomics. So Yersinia pestis was detected in proteins in the dental pulp. So perhaps, this technique could be applied to remains from ancient Egypt. So this slide basically shows a painting of the Great Plague of London in 1665. As we don't have any real physical evidence of plague in ancient Egypt, looking at how it impacted people during other periods in history, I think helps our understanding of the disease. It's actually remarkable, I think, how something so minute that it can safely tuck itself away in a flea can cause such devastation. Yet many of our worst diseases are vector-borne diseases. In this instance, of course, the vector being the flea, but other vectors can be flies, ticks, mosquitoes, and many microbes actually rely on multiple vectors. So, if we have a look at malaria, for instance, This is carried by many different species of mosquitoes, and we know that malaria was endemic in ancient Egypt. In fact, ancient DNA of the organism that causes malaria has been found in tissues from 2 ancient Egyptian mummies from different tombs and different time periods. So there's one from the New Kingdom period and there's one from the late period. So it's actually the female mosquito Anopheles and not the male that infects us with malaria. So the protozoa passes from the mosquito saliva to the human bloodstream. Anyway, sorry, I'm digressing. Going back to the plague of 1665, thankfully, this was the last major outbreak of bubonic plague in Britain. So I feel, this painting really depicts the horrors that a plague can cause. Bodies are piled up in carts and being deposited in pits. The fear, desperation, and helplessness of people can be seen. And of course, we can see this terrifying face mask that the doctors had to wear, which would not have protected them that well. And okay, so now we're going to have a look at poliomyelitis. So this is an infectious disease caused by the poliovirus, which can invade the central nervous system, and it results in a degree of muscle paralysis. So there's very little evidence of poliomyelitis from ancient Egypt, but one such case is this one here of Sipta. He was found in the tomb of Amenhotep II, and in 1898 he was unwrapped. No, sorry, he was unwrapped in 1905 by Grafton Elliott Smith. So what Smith noted was shortening of the right leg, which is associated with muscle atrophy, which he thought was a result of polio. So other instances of polio include a mummy dating to around 700 BCE that was studied by Mitchell in 1900, and a recent CT study by Zaki et al. Of a New Kingdom mummy housed in Cairo Museum. Not everyone agrees with these results, so the evidence of poliomyelitis still remains inconclusive. But polio, it can cause this kind of defect on the foot as well. So possible evidence from ancient Egypt itself can be seen on this 18th, 19th dynasty limestone funerary stele of Syrian priest Roma, which is now in Copenhagen. So the stele describes Roma as gatekeeper at the temple of Astarte in Egypt, and he's shown with his wife and son, and he's actually bringing offerings of fruit, a gazelle, wine for the goddess that he believes saved his life. And if you have a look, he does have wasting away of his leg, which very much looks like what polio would do. Oh, did anyone ask me something? Sorry.
No, I was just muting someone that had just rejoined.
Oh, okay. Okay, so now we can have a look at tuberculosis. This disease is actually studied a lot. It's quite a devastating disease. So it's a bacterial infection, and we can see the bacteria here that causes it. It usually affects the lungs. It can affect the kidneys, the spine, the bone marrow, and it can affect the brain as well. So symptoms really depend on which organ is affected. So Mark Harman Ruffa, who was a paleopathologist, in 1910, he detected tuberculosis in the spine of this priest here in the slide. He is a priest of Amun during the 21st dynasty. So this priest basically, he's displaying typical features of Pott's disease, with considerable damage to 4 thoracic vertebrae in the first lumbar vertebrae, which is producing this angular kyphosis that you can see here. So molecular analysis has also provided us with additional evidence of tuberculosis in different time periods of Egyptian history. So it ranges from 3000 to 500 BC. So we know it was prevalent in ancient Egypt. Zink and his team, they found evidence of ancestral Hemp tuberculosis. So there's 3 major strains. So this strain dates to the pre-dynastic period, and then from there's another strain from the, there's one from the pre-dynastic, and then there's one from the early dynastic period from Abydos, which is M. africanum strain, and then we have the more modern strain from the New Kingdom period. So if we have a look here, so there are representations of humpback servants in tomb chapels, which could be depictions of Pott's disease. It's difficult to be certain, as these could alternatively be representations of Porter's hump, or they could be ankylosing spondylitis, which is an inflammatory disease that over time can cause some of the small bones in the spine to fuse. So it's difficult to say, but as you can see in this slide, he definitely has quite a hunchback. So this could be what it is. So we're going to move on to leprosy. And this is caused by Mycobacterium lepra and recently related organism lepromatosis. So Mycobacterium attacks specific areas of the body, such as the skin, nasal tissues, peripheral nerves, and bone. So in this slide, we can see Princess Diana of Wales with women at the leprosy and tropical disease ward in a hospital in Zimbabwe in 1993. And I was very touched by this picture. You can see that the women are so happy that she's there. I found it very touching. And in this slide, we can see the devastation that leprosy can cause is very, very devastating, this disease. And you can see the loss of nerves, what it's done. This woman's lost her fingers. And here again, we can see the devastation that this disease causes here as well. So it is truly devastating, leprosy is. So the earliest known case of leprosy from Egypt is from the Dakhla oasis. So it was anatomist and anthropologist Rogalski in 1977 who diagnosed 4 cases of leprosy through the examination of well-preserved skulls, which were recovered from a burial ground in Balat, dating to the Ptolemaic period. These are a couple of the skulls. Prior to excavations at Dakhla, the evidence of leprosy in ancient Egypt has been virtually non-existent, apart from a brief mention of what has been conjectured to be the disease in Papyrus Ebers and a 6th century AD Christian burial in Nubia. So I mentioned constitutumors before. So Papyrus 877 mentions possible tubercular leprosy, translated as constitutumors, but again, this is very debatable. There's a lot of people who don't agree with this, and I question this as well, because Ebers dates to a much earlier period than the Ptolemaic period. So this papyrus dates to sort of the New Kingdom period, and there isn't actually any evidence of on any skeletons that have been discovered prior to the Ptolemaic period. You know, it could be, it's been suggested that people with leprosy were not mummified, but I think, you know, it would still be seen on the skeleton, so there's not a lot of evidence. So some people have suggested here that these tumors could even be gas gangrene rather than leprosy. J.F. Nunn suggested it could be cancer, it could even be bubonic plague, it could even be neurofibromatosis. I mean, it's hard to say. So it sort of really depends on the translation. But here we can see what leprosy does. I mean, if you have a look at the skulls, the way it's damaged the nasal area and the teeth. And here, if we have a look at what it's done, I mean, the fingers end up looking quite needle-like. It's just destroyed the fingers here. So in 2005, using comparative genomics, geneticists traced the origins of and the worldwide distribution of leprosy from East Africa along human migration routes. So they found 4 strains of this disease. So I think there was, trying to remember, so one was in Asia, There was one, the strain 2 was Ethiopia, North India. Strain 3 was Europe, North Africa, the Americas. And there was one that was from West Africa and the Caribbean. But the oldest skeletal remains of this disease are actually dated to 2000 BCE. And this is from an archaeological site in Harappa, which is now in Pakistan. So we're going to move on to tetanus. So this is caused by a neurotoxin produced by the bacterium Clostridium tetani, and is commonly found in soil, manure, saliva, and dust. So it's characterized by lockjaw, muscle rigidity, and painful muscle spasms, which I think, this picture really portrays it really well, the devastation that this can cause. In antiquity, although this condition would have been fatal, it can't actually be detected in human remains. So the only possible evidence we have of this condition is in the Edwin Smith Papyrus, case 7. So this case describes a gaping wound to the head. And one of the symptoms that it refers to is contraction of the muscle attachments of the mandible and the neck. So once this occurs, the mouth is unable to open. So the patient basically has a locked jaw. So what the ancient Egyptians did to treat it, they would insert a padded wedge into the patient's mouth to hold it open, because with a locked jaw, it's very difficult for the patient to open their mouth. So this would have facilitated breathing, and it would have helped feed the patient liquids, and they probably would have given a broth of carrot beans, for instance. And of course, they would have had the patient sitting up as well for this condition. So it was James Breasted who first translated the Edwin Smith Papyrus, and here he is. And I'm sharing this because I love this picture, and this is my dream office. I would love to have this office. You wouldn't mind translating a huge manuscript in an office like that, would you? It's fabulous. So now we're going to have a look at schistosomiasis. This is a parasitic disease caused by worms that infect multiple organs, including the liver, intestine, bladder, urethra. And here on this slide, it provides the life circle of this parasite. So evidence from ancient Egyptian texts, artistic representations, and physical remains suggest it was endemic in ancient Egypt, and it still is. Infection occurs during contact with water infested with a free-swimming form of the worm, which is released by the snail, which you can see in the picture. So it can cause damage ranging from stunted growth and infertility through to chronic organ failure and death. So it's even known to cause bladder cancer, and it wouldn't surprise me actually if some of the ancient Egyptians suffered from bladder cancer. Schistosomes can actually live in humans for more than 20 years. Isn't that remarkable? For 20 years you could be infected with this. So what they do, they continue to breed and produce thousands of eggs in the human host, with half being released back in the water through feces or urine, and the other half remain in the body. So it's horrible. So Mark Harman Ruffa, who can be seen in this slide, he was the first to discover the presence of calcified eggs of schistosomiasis hematobium in the kidneys of 2 20th dynasty mummies. So I want to talk a little bit about Ruffa because he's actually a very interesting person. He was a pathologist and bacteriologist and the pioneer of paleopathology. So he moved to Egypt for health reasons, and he became professor of bacteriology at the Faculty of Medicine in Cairo University. He worked on mummies there, and he established the field of paleopathology. He actually had 4 academic degrees from Oxford University, which doesn't make me feel so guilty for carrying on studying throughout my life. So he had 4. And interestingly, he was also clinical assistant of Louis Pasteur during the anti-rabies campaign in 1889. So he was a prolific writer and linguist, and he had interest in several medical disciplines before concentrating on paleopathology. So he went to Greece during the First World War as Commissioner of the Red Cross to improve sanitation. So on the way back to Egypt in 1917, the ship he was on was torpedoed without warning by a German submarine. So he's believed to have drowned, but his body was never recovered. So I think, it was a really sad, tragic loss of a great man. I mean, imagine what else he would have done. And I just thought it's really sad that his body wasn't found. So several studies since have discovered evidence of schistosomiasis in mummified remains, including a study of schistosomiasis conducted by the University of Manchester several years ago now. So as radiology was an expensive procedure and histology was dependent on tissue being obtained from specific areas of the mummy, Dr. Patricia Rutherford of the University of Manchester, she decided to adopt an immunological approach, and she actually pioneered a technique called immunocytochemistry, which successfully detected this disease in mummies. So these results were also confirmed by means of enzyme-linked immunosorbent assay, which is known as ELISA, and also through DNA studies. So calcification in the bladder wall is most likely to indicate schistosomiasis. There is possible scriptural evidence of this disease from ancient Egypt, and the ancient Egyptians wrote about blood in the urine, which is one of the classic symptoms of schistosomiasis. There is a disease which I don't know how they would have pronounced it, but I call it the AAA disease because it's which could be referring to schistosomiasis. So to treat schistosomiasis, the ancient Egyptians would have used an antimony-based drug. Also, fruit of the balanite tree was used. And I think this is really interesting because in the wild, baboons use fruits of the balanite to tackle schistosomiasis. So I always wondered, if they'd observed the baboons in the wild using this, and this is how humans thought about using this. It looks like peanut sheets were also used to protect men while they were working in the Nile River. So this is actually the passage that I was talking about, which possibly describes this disease. By the way, schistosomiasis was not the only parasitic infections the ancient Egyptians had to worry about. They also had to worry about roundworms, tapeworms, and tapeworms can actually grow up to 20 feet, which is incredibly long. So we're going to move on to atherosclerosis. So most of the information relating to cardiac pathology from ancient Egypt comes from the medical papyri. And I did talk quite a lot about medical papyri in a previous talk with Explorers Club. There's possible reference to angina in Papyrus Ebers 191, which describes pain in the arm and the chest, and it provides a herbal remedy to be drunk by the patient. There's also possible evidence of varicose veins as well. This is in Papyrus 876. So atherosclerosis is a primary cause of heart disease and stroke. So in this disease, arteries become clogged with fatty substances called plaques. It was once thought to be a modern affliction due to a sedentary lifestyle combined with a high-fat diet and tobacco consumption, but we now know it was a disease of antiquity. So Ruffa, who we looked at earlier, he was the first to detect atherosclerosis in an Egyptian mummy. And over the years, radiological studies have continued to detect arterial calcification in mummified remains. There's a study by Harman in 2013. This was a multidisciplinary study where I think they were called the Horus group, and they studied 52 mummies dating from the Middle Kingdom period to the Greco-Roman period. So they used mummy demographic data, cardiovascular findings, sex, age of death, all of these were recorded. And what CT results showed was that 20 out of 52 mummies in whom cardiovascular tissue was present had definite or probable atherosclerosis, which is quite high really. And of the 20 identified, 55% were male and 45% were female. So Rosalie David and her team, Rosalie David from the University of Manchester, suggested the incidence of arterial calcification could be the result of an atherogenic diet consumed by the elite, particularly the priestly class. And I've provided a few things here that they could have eaten. So the paleopathological evidence in conjunction with the ancient Egyptian texts on temples indicate the diet of the elite consisted of some foods that were high in saturated fats, such as goose, which contains a staggering 63% energy from fat. So this food formed part of the offering left in temples and was subsequently eaten by the priest and the family. So you can imagine the priest taking all the food at home saying, honey, I'm home, I've got roast duck and honey cakes again. And the wife probably said, oh God, not again. But on top of this, they would have had alcohol, which increases triglyceride levels. So, and you know, we talked about alcohol in a previous talk, and it looks like they consumed a huge amount of alcohol, a lot more than the daily recommended dose today. On top of this, their salt intake was probably high because it was used as a preservative, food preservative. And it also appears that the Egyptian priests consumed very little fish. And we know now that oily fish is a major source of omega-3 fatty acids and helps in the prevention of cardiovascular disease. So it looks like the lower classes consumed less meat and had more of a vegetarian diet. So you'd expect to find less cases of this disease. But Allen et al. In their study, they found less evidence of this in priests and priestesses. So I think, you know, further studies are needed really to see how much of Egyptian society was impacted by this disease. So it could be that just like in modern times, some people had a genetic predisposition to this disease. Textual evidence of heart disease can be found in some of the medical papyri I mentioned earlier. So paragraph 855 of Ebers consists of glosses that could be referring to a failing heart disease or a failing heart or congestive cardiac failure. Unfortunately, statues, reliefs and paintings don't really offer a lot of evidence. But so this is Ramesses II here and here, and he was found to have atherosclerosis in his femoral arteries. So too was his son, Merneptah. I think his was aortic calcification. And it doesn't surprise me actually, because Ramesses II was about 90 when he died. So it wouldn't surprise me if he was suffering from heart disease. He was also suffering from severe arthritis, and it would have been quite crippling for him. He would have probably had to have walked with a stick. I think, you know, the last few years of his life would have been really painful. He also had appalling teeth as well, a lot of infections, and yeah, so he would have been in not a good state of health. I think his mummy is fabulous, and this is why I share that he's been mummified to an incredible standard. In fact, there's a little bone in his nose to retain this fabulous regal nose that he has, I think, you know. And I found his hair interesting because his hair is blonde. And it's been suggested that it could have been the natron that dyed his hair blonde. He did actually have naturally red hair, although it would have been grey by this stage. But Egyptologist Janet Davey, she did a study to find out if natron would have bleached the hair blonde. And she found that it wouldn't have. Even mixed with a little bit of henna, it wouldn't have dyed the hair blonde like this. So I do recommend reading her paper, it's interesting. So we don't know why his hair was blonde. Maybe he used to dye his hair blonde in his lifetime, who knows? Or maybe it was a fashion trend. There are other mummies that have been discovered with this fabulous blonde hair. So it's an interesting one. We're now going to have a look at cancer. This is a disorder of autonomous unregulated cell proliferation. So it just means that cells start multiplying. Malignant tumors affecting bone are either carcinomas, and these emerge from many organs in the body, or they're called sarcomas, which develop in tissues such as muscle and bone. So to date, paleopathological evidence suggests a low incidence of cancer in ancient Egypt in comparison to modern societies. So one possible explanation for this is that the risk of cancer increases with age. So evidence from human remains recovered from archaeological sites, they suggest that life expectancy in Egypt was lower than most modern societies, and therefore we'd expect less cases of cancer. Another factor which has been suggested is the rapid increase in carcinogens due to environmental issues, that are related to modern societies and particularly industrialization. So Dawson and Smith, they studied a huge amount of skeletal remains and a lot of mummies, but they report minimal incidences of cancer. They did find a large osteosarcoma of the femur and 2 cases of sarcoma in the head of the humerus in the cemetery of Giza pyramids dating to the 5th dynasty. I think it should be noted that where human remains are concerned, if they're mainly skeletal, such as those that were exhumed by the Archaeological Survey of Nubia in 1907, we have to take pseudopathology into account. So it's really important to consider this, because taphonomic processes due to burial environments, they can lead to an inaccurate diagnosis of cancer. So growth of plant roots around and through the bone, the gnawing of rodents and burrowing insects, they make these sort of punching sort of type holes in the bone, which can mimic cancer. Then of course the converse is also possible, whereby cancer lesions are incorrectly attributed to taphonomic destruction. More cases of cancer are being detected with the advancement of technology and improved diagnostic techniques, such as the latest CT scanners. So it could be, and I believe this, that some cases were overlooked or misdiagnosed, and some primary cancers may not have spread to the bone to be visible for detection. So we're also learning that ancient Egyptians were exposed to pollution, so more incidence of cancer may still be found. So recently there have been some new diagnoses. So this, as we can see in this slide, a Ptolemaic male mummy, age 50 to 60, who's on display in Lisbon's museum. So here on this slide, what we can see, images basically allow the diagnosis of osteoblastic disease. And what they found was that it was prostate cancer. Another example is 2 mummies from Aswan, who were studied by an international team led by Professor Lopez, and they discovered a woman with breast cancer and another man with multiple myeloma. So Molto, in 2018, he described 6 cases of cancer from the Darklo Oasis. So what evidence do we have from ancient Egypt itself? So we do have a few references to what could be tumors. the Edwin Smith papyrus, case 45, mentions round masses on the chest. This could be referring to tumors. J.F. Nunn thought that Papyrus Ebers A13 describes uterine cancer, but this has recently been disputed. So again, consu tumors, again, this could be referring to cancer, but again, it just depends on translation. Right, now we're going to have a look at an ancient murder case. So this is Takabuti. She arrived in Ulster Museum in the 1830s. So I've got some other pictures of her here and here. I think we get a better closer look of her. So she lived over 2,600 years ago and died in her 20s. She's thought to have been a married woman who lived in a Theban house, maybe of high status. She's actually very popular amongst visitors in Ulster Museum. Some people go there just to see Takabuti. She's very, very popular. So a year ago, she was studied by a multidisciplinary team, which I'm proud to say includes many of my professors at the University of Manchester. So Tony Fremont, Constantina Dressau, Rosalie David, Roger Forshaw, and many others. So they collaborated with Ulster Museum, Queen's University Belfast, Kingsbridge Private Hospital. So they actually uncovered some remarkable things about this lady, which, you know, blew my mind. I thought it was really interesting. So firstly, her DNA was found to be more genetically similar to Europeans rather than modern Egyptian populations. She also had an extra tooth, so she had 33 teeth instead of 32. And this is incredibly rare. There's only 0.02 of the population that have this, so incredibly rare. A mysterious object was in her body cavity, and it was thought to be a heart, but in fact it was material used to pack a knife wound. So what they discovered was that she was violently stabbed in the upper back near her left shoulder, which would have been the cause of her death. But what's really, really, really fascinating is that proteomics research showed that she was probably running at the time when she was stabbed. So I just think, you know, it's incredible what technology can show us now. So a book is coming out on this. I think they're still in the process of writing it, so I'll let everybody know when it's published, but it's going to be brilliant, and I really recommend everybody buys this book. It's going to be incredible. So we're going to now have a look at disability. So disability, it can be defined as physical or mental impairment that has a substantial effect on a person's ability to carry out normal daily activities. I feel it's a modern social construct which sometimes carries negative connotations, but in ancient Egypt, disabilities or deformities were considered divine attributes granted by the gods. So there's a wisdom text dating to the Ramesside period, and one of the instructions specifies that a blind person should not be ridiculed, a dwarf should not be teased, the sick or insane should not be mocked or criticized, and no one should cause difficulties for the lame, since all these people were created by the gods and therefore should be treated properly. Now, I think that that is beautiful, but it has been argued by some people that the advice existed because those with disabilities may have needed some form of protection. In terms of mental illness, the Egyptian sources make no specific references to conditions associated with it, but the medical papyri do mention some psychic or mental symptoms. So the medical text describes seizures, but you know, they don't really specify the cause, such as epilepsy. Now, disabilities didn't prevent individuals from attaining high positions among the household of the king and high officials. Achondroplasia, for example, was not seen as a genetic disorder or a disability as such, and rightly so, of course. So dwarfs were part of society, taking on high official roles. An example is Senep, who can be seen on this slide. He's from the Old Kingdom period, and he accrued considerable wealth, and he was married to a high-ranking priestess with whom he had children. So here we can see his limestone sculpture. So he's sitting cross-legged in the manner of a scribe with his wife Senet and their children in the lower register. So another example, of course, of a person with disability attaining a high-ranking position was someone we looked at earlier, Roma, who had poliomyelitis. So Papyrus Ebers provides remedies for blindness, and in imagery we see what appears to be blind harpists not being hindered by their disability and continuing to be provided employment. It could be that being a harp player was a job that was given exclusively to the blind, perhaps a state-sponsored service to help them because they couldn't have participated in the building of tombs. It's difficult really to know for sure because this could just be an artistic impression. We're not 100% sure, but what I do want to mention is something that has been asked before, and it's that often lead, which is used in eye paint by the Egyptians for cosmetic and medicinal purposes, is thought to have been detrimental to their health due to the not toxic nature of lead. But a study, and I think you'll find this really interesting, Sarah, a study in 2009 by Tabsaba et al., they found that these lead compounds were deliberately manufactured. So their study provides new insights into the biochemical interactions between lead ions and cells. So this would support the ancient Egyptian medical use of soluble lead compounds. So these are the 4 lead compounds that the ancient Egyptians would have used. So using scanning electron microscopy and quantitative X-ray diffraction, they analyzed 52 samples of makeup taken from, that were preserved in the Louvre Museum. So they identified these lead-based substances in the makeup. But anyway, to cut a long chemical story short, because I don't want to put everybody to sleep, they found that these lead substances boosted production of nitric oxide by up to 240% in cultured human cells. So nitric oxide is a key signaling agent in the body. And what it does, it boosts our immune system and it helps us to fight diseases. So, okay, so I had to share this. Therefore, the eye makeup would have actually helped fight bacterial infections. So I'm a huge fan of Elizabeth Taylor, especially as Cleopatra. So this gave me the perfect excuse to share this slide. But if anybody wants to know a little bit more about this paper, just send me a message on my academia account and I can forward the paper because I think it's really interesting. And I'll give you guys a few seconds to absorb this fabulous picture. Her eye makeup is great. And you know, I think she did it herself as well. She did her own eye makeup.
I was reading something about how people are upping their eye makeup game with coronavirus because the mask wearing, and I've been doing that myself. I think we should all go a bit more Cleopatra.
Actually, you know, when the lockdown's over, if anybody knows how to do this makeup, I wouldn't mind having it done on me. I would not be able to do this. It's fabulous. But yeah, I don't blame people for doing that because that's what you see now.
Exactly. And if you don't kind of up your game, you just get left out, I think. No one notices who you are.
So true. So true. So There is everybody still here? I can only see Sarah.
Yeah. Oh, really? You can only see me. You should be able to see. There's little. There's more than me here. There's still
Okay.
26 of us. No, more than that. 26 of us, something like that. 28.
Good. So we're all still here. Good. I've not put anybody.
Haven't lost anyone.
Yet. Okay, so there's paleopathological evidence that a medical infrastructure existed which aided the recovery of those suffering from broken or fractured bones or even limb amputation in sites such as Deir el-Medina. So in Deir el-Medina workers village, Egyptologist Anne Austin, she discovered the remains of a man who was probably aged 19 to 20, and his right leg was wasted, probably due to polio. But he didn't appear to have any other health issues or trauma to his skeleton, leading her to believe he didn't have a hard life, and the community would have found a role for him that wouldn't have involved hard labor. So you can see anyone with disabilities, they are looking after them. So, and I just want to thank Anne for letting me use her pictures as well. I do recommend her dissertation as well, actually.
Oh, I did get in touch with Anne about Deir el-Medina, and she's going to be coming to give a talk soon. I can't remember what the date is. I can't remember whether we've confirmed the date or not, but we'll be doing an explorer's.
Oh, she's brilliant. That's going to be a fabulous talk.
I think that it was especially because she did a study on the tattooed woman, didn't she?
Yeah, she did. Yeah, she did a talk for us actually at the University of Manchester. And her talk was so interesting. Like, it's really good. It's really good. I'm not going to give it away if she's going to come, but it's really interesting. So yeah, so I was saying, so there's various situations in which fractures, wounds, dislocations, and amputations could arise. So, you know, this would have included warfare, interpersonal violence, accidents, legal punishments, even medical intervention. So we find instances of these conditions being recorded, and you know, there is some inscriptional evidence about this. So the Edwin Smith Surgical Papyrus provides a detailed account of treatments for trauma and wounds, which may relate to injuries sustained at royal building sites such as Deir el-Medina. So treatments included joint manipulation to reduce fractures and dislocations. And in this slide, we can see a fracture that has healed so well. And, you know, when we are looking at healed fractures, we know that it's had treatment, because if it hasn't had treatment, it won't heal very well. It won't be a nice, clean wound like this. So, oh gosh, this case I find is so interesting that I had to share it with everyone. So this is case 9 of the Edwin Smith Papyrus. It describes a fracture of the frontal bone of the skull. So it's the only case out of 48 in the Edwin Smith Papyrus that mentions magic. So remember Breasted, who I showed you earlier with the fabulous office? He loved this papyrus because it's very medical and very rational, but he was very disappointed when he saw this case because it mentions a little bit of magic. He needn't have been disappointed because a recent reevaluation of this case by Sanchez and Meltzer have proved that he was wrong, that this is not just magic. So the treatment for this involved placing a mixture of ground ostrich shell and oil on the wound. And this was followed by a coating of dry ostrich shell. And to the right, you can see that this has been done here. So it was thought originally, as I mentioned, that this was sympathetic medicine with the ostrich eggshell representing the skull. But studies have shown that ostrich shell would have been used by the ancient Egyptians as a bone graft to seal the bone defect, because ostrich eggshell is actually 97% calcium carbonate, and it is currently being used as a graft to fill partial bone defects. So wow, again, to the ancient Egyptians, they knew this thousands of years ago. So I just think that is incredible, really incredible. So prosthesis that was made specifically to replace missing body parts also provide examples of disability in ancient Egypt. So here we can see excavation number 453, which is a 3-part wood and leather toe, which is found on a female mummy buried near Luxor in Egypt. It's been dated to Dynasty 21 to 22. And there's another one here. So this is prosthetic foot, British Museum, which is made of cartilage. And this has been dated to before 600 BCE. So design features and analysis suggest that both devices would have functioned as prosthesis, possibly with a stabilizing sandal. Both were made by skilled craftsmen aware of the materials and of foot anatomy. It was actually a University of Manchester researcher, Dr. Jackie Finch, who tested replicas on volunteers and demonstrated that these were in fact functional, because it was thought they might have been placed on mummies after people had passed away because maybe they'd lost their foot, but no, these would have been used in their lifetime. So just looking at the time, okay, we're okay. So who would have provided medical care? So here on the first door, which dates to the first intermediate period, we can see a range of medical professions that would have provided medical care for the royal household. So, you know, you can see them all here. We've got eye doctors, proctologists, and so this is really interesting. So in villages such as Deir el-Medina, workmen who functioned as Sunu were found to possess, you know, instructions of how to carry out treatments. In Deir el-Medina, they also had the priests of Circuit. So the priests of Circuit, they would have been called to deal with snake bites or scorpion bites. They also had wise women. There's also records of wet nurses, and they had midwives as well. So if we have a look, oh, I think, sorry, this one first. I've got the wrong order. So this is an ostraca from the British Museum. From Deir el-Medina is where it was discovered, and it records absences from work during the reign of Ramesses II, and it mentions a man called I'm going to try and pronounce his name correctly. Palaeopathology, I think is how you pronounce it. So he could have actually been a pharmacist. He could have been a Sunu, who is a physician, or both, because he's recorded as being absent to prepare medicine and to take care of the sick. And if I just go back one. So here we can see evidence of the Sunu themselves, the physicians. So on this slide are 2 stelae belonging to Luni. So the left is in the Ashmolean Museum, the right is in the Louvre. So they date to the 19th dynasty. So the left in the second register names a physician and his son, Kai, and the right also names a physician and his son. So it looks like this is a profession that could have been passed down the family. So it's thought that they could have had their training in the Parang, could have been a medical school, but it's more likely that it functioned as a scriptorium. We're not 100% sure. And I'm going to end the talk with the first authenticated doctor in the world, whose name was Hezira. So he dates to the Old Kingdom period, the 3rd dynasty. So he was recorded, he had lots of different titles, but one of his titles was Chief of Dentists and Doctors. So I thought, you know, he's worthy of a mention. He had several titles under King Joseph, and his tomb is north of the step pyramids in Saqqara. So 6 well-preserved wooden stelae were found in his tomb, which are now housed in Cairo. So I just want to say thank you.
Thank you so much, Sophia. That was brilliant. I've got a few questions, and then you are very welcome to unmute your microphones and ask Sophia your own questions, or if you want me to ask them for you, you can just type them up in the comments there. See if we've got anything so far. Arthur said that there were a couple of the deformities. I think he's referring to the club foot style deformities that look like they could potentially be cerebral palsy. Is there any, I think that because they are unilateral changes in the bone.
He's absolutely right. It could be 100%. It could be polio. It could be that as well. Definitely, yeah. I think, you know, there are cases of cerebral palsy from ancient Egypt as well, so it could be.
One of the questions I wanted to ask, and I'm sure I must have brought this up with you before because it's one of my pet favourite subjects to talk about, is what about incidences of Toxoplasma gondii in ancient Egypt? Because they were all cat fanatics, and Toxoplasma gondii is a parasite that comes from cats and makes people really love cats, and engaging all sorts of slightly risky behaviour. And I wonder whether that's something that's possible to find in ancient Egyptian remains.
I should have looked this up because I remember you asking me this before. I don't think you can find it in ancient remains, but I was going to have a look in the medical papyri if I could find something. I don't think that there's anything in Ebers about it, but they had to have it. I mean, the fact that they had cats as pets and they even mummified cats, you know, it has to be there. It's something that I need to definitely look up. I do have Papyrus Ebers.
Well, it's very interesting when you look at the toxic effect of Toxoplasma gondii. I read a really good article about how countries where there's high levels of Toxoplasma gondii infection even have certain social personal traits. It affects the amygdala, I think, so that basically what you should be a bit scared of makes you a bit turned on. So it affects sexual behaviour, and it apparently makes people more risky drivers, but then also weirdly makes people more likely to obey a strict authoritarian regime. Really weird. So it could be something that was quite huge in Egypt by the sounds of all those things.
I would have thought so. I would have thought so, and I will get back to you on this, Sarah.
I think this could be like
see what I can find.
Great niche area of research for you, Sophia.
Yeah. I think it's great, and if I find something, I'll write an article on it. It'll be good.
Oh, I would love that. Someone was asking about, is there much evidence of women with disabilities?
Yes, I think we find disabilities in men and women, definitely, in both. I think Daryl Medina's provide a lot of evidence of this. So yes, the answer is yes.
How about things like, I think we've talked about this before, contraception. I remember reading somewhere that crocodile dung was used as contraception, but that sounds a bit peculiar. What do you think that might be referring to?
I've come across this, I've written about this as well. Yeah, apparently they did use pessaries of crocodile dung, which would have been inserted into the vagina. And it does seem really odd. I don't even know who would have collected the crocodile dung.
I can't imagine anyone's just like, I've got a good idea. I just found a load of crocodile dung up there. That will put
I don't know who thought that.
Getting pregnant.
But apparently it does have spermicidal properties, so it could have been partially effective. So
I can't imagine it would have been a very nice experience for anyone though.
But it has been suggested that maybe the crocodile dung is, you know, it's not actually crocodile dung. It could be describing some kind of earthly sort of something else. Some other.
I was wondering about that as well because of the name of Kemet and the crocodile's hieroglyph being in that name. I wondered whether it might refer to something that's not.
I personally like to think of it as crocodile dung.
What about, I read somewhere recently about any conditions to do with neurology, and I read somewhere that the Egyptian word for the brain was something that translates loosely as skull offal, because they didn't think the brain was especially important. Have you seen that anywhere?
Okay, so yeah, so they basically, there is a word called for brain. It's spelled AIS. How they would have pronounced it, I don't know, but I say ACE. So they did recognize the human brain 100%. And actually, this is what my research project is on. So watch this space. I'm actually researching this at the moment. So yes, they did recognize the brain. In the Edwin Smith Papyrus, they mentioned the brain 6 times. They also knew that if the brain is injured, it can cause paralysis of the body. And, you know, they did understand the neurological implications of a head injury. So, you know, I don't personally agree that they didn't understand the function of the brain completely, but this is going to be in my research.
Nina asks, what do you think ancient Egyptians would have done to deal with COVID if they were around today?
Well, I think, you know, with COVID, it would have been like they had a special word for something that causes pain or disease called wekedu, and it could be that they would have thought, I think, you know, to a certain extent, although they didn't know what bacteria or viruses were, they had a concept of pathogens as something external can make us ill. So, you know, something like COVID, I think, you know, they would have had good remedies for it because they had good remedies for colds and things. So, I think, you know, they would have thought it could possibly be demons, disease-carrying demons, or maybe punishment from the gods. So they probably would have had amulets as well to protect them, prayers, incantations.
Things like fumigation from certain incenses and things like that, would that have been considered purification?
Yeah, I mean, I think a lot of illnesses they thought also could be related to the anal area, and they did a lot of enemas and things to help them, but also, you know, to counteract insects, they used a lot of fumigation. So it's definitely possible. And the products that they would have used would have definitely have been antibacterial. Antiviral, I don't know.
I was just a couple of weird questions. Is there any evidence of trepanning in Egypt?
That's a great question. That's a great question. And the answer is, it was thought there wasn't, but now we know there is.
Oh, okay.
So definitely, yes.
And was there some, is there some information in the medical papyri about it being useful for any particular condition? Like, is epilepsy mentioned or anything like that in the papyri?
So with them, there's no mentioning of trepanning in the medical papyri, so we don't have it. It's been discovered in skeletal remains, where there's this perfect hole, which you can tell would have been done deliberately. Sorry, what was the second part?
Yeah, I was just going to say, because sometimes trepanning is something that's used as a treatment, or one of the treatments for something like epilepsy. So I was wondering if there's anything that suggests epilepsy in the papyri.
Yeah, I mean, you know, there's not exclusively, to be honest, any reference to that, but I think, you know, there is a few references to mental illnesses, which possibly is that, but not clearly, nothing clearly. But why they did the trepanning, we're not 100% sure, but it wouldn't surprise me if it was something like that, or for maybe some sort of swelling in the neurological swelling. We don't know, but there is some evidence. But it's not mentioned in any of the medical papyri, unfortunately.
And the other thing was, is there any evidence of infanticide?
That's a really good question. Who asked that question? That's a great question. I would say the answer is possibly no. I don't think so. I don't think so, but maybe if anybody's got any evidence of it, I'd love to know. But I have not come across any evidence. I think they, they really love their children. Even
Yes.
fetuses were mummified.
Yeah, it's very interesting to me what you were saying about their ideas about disability and the fact that disabilities were seen as still having a divine element to them. And you look at other cultures that were alongside them, and infanticide was quite commonly practiced, like the Minoans and the Greeks, and Spartans just used to leave that, if there was anything wrong with their child, would just leave it on the side of a mountain. But interesting that there's no evidence yet, or that I know of, about infanticide in Egypt.
Yeah.
Well, there's some evidence, I think, that in Greco-Roman times, where Greeks used to just throw unwanted, especially girl children, on the local rubbish heap, Egyptians used to rescue them and adopt them.
Oh, that's brilliant. That's even better.
Sorry, well, I missed the last bit. So yeah, from the Greco-Roman periods, it changes. But from the, what can you repeat that? Sorry, I didn't hear you.
I couldn't hear Arthur very well, but from what I gathered, he said that the Egyptians would rescue discarded baby girls from rubbish heaps and bring them up themselves.
Wow, that's very interesting. Thank you for that. That's really interesting.
Someone asks about STDs. Brian?
Brian, what a great question.
So, were there any types of STDs that you find
there isn't actually any evidence of syphilis. I know this from ancient Egypt. We don't have any evidence of syphilis. And if they did have sexually transmitted diseases, they kind of kept it to themselves, because there's not really, they must have had them, they must have, but physical evidence is tricky, is tricky. They talk about a lot of things like contraceptions and everything else, but they're not talking about STDs.
Carl, you've got your hand up. Did you want to ask a question?
Oh, yes. Well, sorry. I put my hand up because just now, because of the conversation about infanticide, and whether there was any evidence for it. Sorry. Hi. First of all, thank you, Sophia. That was really insightful, the talk, especially on just evidence of diseases. That's something new to me. All I wanted to kind of chip in to include in that conversation is, as Arthur said, the evidence for infanticide only really appears in the Greco-Roman period, because that was a very Greco-Roman practice. And I just wanted to add as well earlier to the mention of is there evidence of women with disabilities? To give one named example, if people want to look into it, there is let me see if I can pronounce her name correctly. I apologize for just jumping in here, by the way. As you can see, I'm also disabled and an Egyptologist, so this is what I research, so if it's helpful. There is a wife of a High Court judge from the Middle Kingdom called Gehaset, who had cerebral palsy, like myself, and she lived till about 60 years old, which is quite old for the Egyptian period, who is a named example of a woman in ancient Egypt with disabilities, but there are many other sort of examples. So yeah, sorry, I just kind of jumped in there and hijacked, but I just wanted to contribute to the conversation because it gets me really excited, and I'm glad that it was brought up as a topic of conversation for this talk. So again, thank you.
Thank you so much for your input. That's really interesting. Thank you.
Alexandra says that HPV could show up in skeletal remains potentially.
Yeah, but have we found any? I don't know if we have from, well, I suppose, we should look for these.
Well, HPV can lead to some cancers, and if they develop, long enough, then it would show up in skeletal remains. So, and I
Yeah.
think the
Hi,
Epstein-Barr
Alexandra.
virus. Hello. The Epstein-Barr virus as well for sort of nasopharyngeal cancers as well has left skeletal remains
Yeah.
as well. Sorry, just jumping into.
It's lovely to see you here. I think, I find cancer generally really interesting because it was thought that cancer is quite a modern disease due to industrialization, our modern living. But of course, we're finding more and more cases from antiquity. So I think cancer generally is really interesting. And I wonder how many cases of cancer were missed. There's probably quite a few that were missed. It is a very interesting subject.
Alexandra says dinosaurs had cancer.
They did. I know, I was amazed about that, Alexandra, that dinosaurs had cancer, which just shows how far back cancer goes. Yeah, I thought that was interesting. Oh, that's better. I can see everybody better now.
No, I just thought to do that. I forgot about it.
That's much better.
Does anyone else have any other questions? Luann, yes, Luann just asks, are there any details about how they treated cancer then?
Well, this has been the issue, that we don't actually in the medical papyri have clear, there's a few cases which have been conjectured to be cancer, but we're not 100% sure that is cancer they're talking about, because it could be several other diseases as well. So there is, I think I mentioned one in the talk about uterine cancer, but it was JF none, so it's eating away of the female's sort of womb and everything, but this has been diagnosed as something else now. So I think, this is the problem. So again, conceived tumors could be referring to cancer, but again, it could be lots of other things as well. So we haven't got that clear evidence. So the most of the evidence that we're getting is actually from human remains.
Jackie, did you have a question?
Yeah, thanks. Can you hear me okay?
Yes.
I don't know if this is something you can answer, but I wonder if there's any evidence of people with learning disabilities, I mean, either in written material, which might be very obliquely referred to, or physical evidence at all.
With learning, I mean, of course, there would have been people with learning difficulties, but I can't think of any that I've come across. Has anybody else here come across anything in textual evidence? Alexandra might have, yeah.
I can't remember the exact source, but I think there is evidence of dyslexia sort of conditions with the scribal schools where they're practicing their hieroglyphs and things. And it's shown signs of dyslexia there, but I can't think of anything else.
Okay.
I mean,
sorry.
Sorry.
No, sorry, it's me again, Kyle. I should have put my hand up again, but the difficulty in identifying what we would call learning disabilities, this is something that Sophia mentioned earlier. There isn't actually a word in ancient Egyptian for disability of any kind, in the same way that we don't really have, so to put it another way is basically what I'm trying to get across is that one of the reasons why they don't necessarily appear in the sources is because whether the Egyptians conceived it as a difficulty of any kind. Does that make sense? So that's why sometimes it doesn't appear. I know of an article, or a chapter rather, in a book that does talk about learning difficulties and mental disabilities in ancient Egypt, and I'm going to see if I can find it now, and I'll put it in the chat. But off the top of my head as well, I can't think of any actual primary sources that mention anything, but doubtlessly there will be something there, for sure. Like Sophia said, I mean, disability is a universal experience to humanity, so it would have definitely existed, but you got to basically read between the lines in order to see it. You've got to be able to, you got to seek the invisible kind of see it. Sorry.
Yeah, thank you.
And also, oh, sorry, go on. I'll let you talk first. It's okay.
No, it's just interesting because I've been studying some history, recent history of people with learning disabilities with people with learning disabilities. And one of the things they heard was they found reference to the ancient Egyptians thought people with a learning disability had demons in them. Now, I can't find any reference to that. So I don't know where that idea or that story came from. But it just made me want to find out more so I can feed that back to our group. And as you say, Kyle, it's about trying to read between the lines and because there isn't going to be a word for it. But I just thought maybe people might be regarded in a special way and that you might be able to interpret it as learning disability. But it was great to have the reference you mentioned, Kyle. Sorry.
Yeah, I think it's also quite a modern social construct as well. And I think their perception of disabilities might have been completely different.
Yeah,
and sometimes they did think of it as divine attributes as well. So they would have seen people as special. And I think, in modern times, there's a lot more negative connotations, which I find really disappointing because I think sometimes it's our environment that can make life more difficult. Rather than the disability itself. So, we should have it. Like, if you look at the way the streets and everything are built, they're not built for people with disabilities. And then, it's difficult to even define disability because there's a lot of invisible disabilities. I would say I have a bit of a disability because I have a congenital disease which causes me problems with my talking and my breathing, but nobody would ever know. That is there, and I've struggled with that my whole life. So, it depends how the perception of it, but I do like the fact that they had this text so that people are not discriminated against due to their disability. So I found that wonderful, actually, that the ancient Egyptians thousands of years ago did think about this. And the harpists who were blind, I quite like the fact that they were given work specifically, possibly because they were blind, they were looked after.
They were also probably extra good at playing the harp because without visual stimuli, they could probably make great musicians. It was
the piano hadn't been invented, so there was nothing for them to tune, I suppose.
Yeah.
I think we should cut the Egyptians, the ancient people, a little bit of slack. Even, say, as long ago as in the recent past, say just after the Second World War, when I was a boy, you didn't recognize things like dyslexia. You just went to the educationally, you were just branded educationally subnormal and sent off to the Dippy school.
In the 80s, you were just a pyromaniac.
Yeah. Or even worse, near where we lived was what was a sort of rehabilitation centre for people who were physically disabled. And they were taught to do useful things like make raffia baskets and knobs for radio sets. And it was called Cripplecraft.
Wow.
Gosh.
Cripplecraft. Big notice outside, the Cripplecraft Centre.
Wow.
And that was what, the 1950s.
Gosh. Shocking, isn't it? Because it was not actually that long ago when you think about it.
I think as well, maybe people that had things like schizophrenia or heard voices or had regular hallucinations would have been seen as having access to other realms and would probably have been sought out as having special visionary capabilities. Daniel asks, is there evidence of diseases in ancient Egypt that we don't even know what they are today? We don't recognize them.
Probably. Do you know, there's a papyrus that's recently been translated, the Louvre Carlsberg, and I'm sort of working my way through it, and I'm reading that, and it's got all these sort of skin lesions, which we're not sure what they are. But you know, there is one in there which is exclusively affects children. And when I was reading, I was thinking, I'm pretty sure I had this as a kid. So I rang up my mum. So it's these sort of lesions, these sort of little tumor-like things. They actually, I can't remember what it's exactly called in the papyrus, but this sort of affects children. It's around the eyes and everywhere. So I thought, I'm sure I had this as a kid. So I rang my mom. I got really excited about it. And I said, oh, Mom, do you remember when I did? She goes, yeah, I do remember that. You had to go to the hospital. They tried freezing and that didn't work. Then they gave you some medicine and then it cleared up. And I said, but what was it called? She goes, oh, I can't remember.
I think that's called molluscum something. It's, I read about this. It's like if you play in dirty water, you get it.
Oh.
And I can't remember what the full name of it is, but I'm sure I had the word molluscum, and I just remember that because it's like a shellfish.
That's interesting. I mean, the problem is my mom doesn't remember, and unless I go to the doctors, but who knows? I used to play.
I'll send you a link, Sophia, and you can see whether it's that.
Because I used to, that's interesting because Sophie, who's translated the paper, she would find it interesting to get any ideas of what this could be. But talking about data, I mean, I used to go to the park and we had this sort of lake in the park. My friends and I used to go and mess around.
Wash your eyes in.
You know, those days we played outdoors.
Were you playing like River Nile games?
Yeah. But yeah.
Let's have a look what else we've got. I think that's about all for questions. We should probably let you go. Does anyone have a last question they'd like to ask Sophia? No, you all done? Okay, well, this is recorded, so if anyone wants it, I will send you the link out as well. And thanks again so much, Sophia. That was brilliant, as always. And thank you, everyone, for coming along this evening. Really appreciate you keeping coming along to all of these talks and buying tickets. It's really great. So thank you very much.
Thank you.
Bye.
Thank you, Sophia. Thank you, Sarah. Thank you, everyone. Take care.
Bye.
Bye.
Bye, everybody.
I'm just going to let you keep waving for ages.